to be practicing this, and we're going to repeat this demo, and I'm going to repeat a few stuff this afternoon that I still feel like you guys are struggling with, this renal arteries. So here's, what is the porta hepatis? Is that the whole portal? What's the porta hepatis? The door to the liver. So am I correct to say the porta hepatis is a sliver and not an entity of the vein, right? Okay. So here is the porta hepatis, right? Can we see the pancreas here?
Yes.
Yes, we can. Good job, guys. So here's the splenic portal. Coming through here. Here's the confluence, right? At the head of the pancreas. Only at the head of the pancreas. The confluence is not the entire strip. The porta is where it's coming in. Here's the door. So now that I'm at the porta, this is the main portal vein. Once I come into the liver, what am I at? Undivided right, because look at, here is my anterior right, and here is the posterior right. So guess what? My duct and my artery are branching with the portal all the time, every time. So I'm going to look through here when I'm doing this gallbladder to see if I see any biliary dilatation in her liver, which I don't. I did a quick sweep. So now I'm coming back to the porta because I want to see if I can see this duct. Sometimes what I'm going to do is just go right to her pancreas, which I prefer. Can you turn on to your back again? Which I prefer because what lives at the head of the pancreas? CBD and GDA. So look, she has this beautiful piece of liver right here, her left lobe, left portal vein. Wow, look at that, guys. Here's her left lobe. I'm on it, and I'm going to angle down through it because I can see her little pancreas better when I'm angling through her liver. That's because I had a little lack of contact. Is that better, guys? How's that? Okay. So here is the splenic portion, right? So here's the head, GDA, CBD. So you can hit color, and I always recommend you guys to put color on because remember, sometimes the way these lay is a little bit different. Nicole's is like textbook perfect. But you guys,
she's really hard for it.
But sometimes the GDA might be a little bit lower or a little more inferior, or the CBD might be a little bit more out to one side or the other. Here, everything's perfect. So I can see GDA, I can see CBD. What I would probably do, since I'm doing a gallbladder study for Nicole, is I would stop it right there with my color on, and I would measure the CBD. How do we measure ducts, guys?
Inner to
inner to inner. Good, good, good. So I would label this CBD. CBD lives at the head of the pancreas. Am I stopping there? No. I'm probably going to take off my color and take another picture to show the doctor that, yeah, for sure that's the duct. And then what? I'm going to get this duct in the center of my image, probably lower my focal zone for one echelon. I'm going to get this into the center of my image, and I'm going to do my little famous heel toe, keeping it in the center, and I'm going to turn long on it. What's going to happen? I'm going to elongate this duct all the way from the head of the pancreas into the liver and into the division of the right and left intrahepatic ducts. So, if I think I got a little bit mixed up, do you guys still see it?
Yeah.
So we still have a hepatic artery coming in here, and the other one's going to be the duct. So here's the duct, right? Keep my eyes on the duct. We can hit color. We can see that that didn't fill in, right? That strip right there. Let's take down the color. We can see our artery blinking. We can see the artery blinking. We can see flow in the portal, and we see nothing in the duct. Now remember that. Oops, sorry. Oh my God, everything's happening. Get off. Okay, so we can see the duct. So we talked a little bit about where do we measure the duct. Do you guys remember? On my lecture? Where do we measure the duct? Anatomically, where do we consistently get to measure the duct? Just proximal to the hepatic artery, right? Why? Because at the hepatic artery, it's dividing now into the right and left intrahepatic ducts. You're no longer in the common hepatic duct. Remember, common meaning two branches equal it. So it would be about here. Here's this little artery going to happen. And can you see the duct right here and how it tapers? So this is actually already the left intrahepatic branch that's going to go up. If you can hallucinate, and I don't know how well you can see it on here, so one coming up, but there's also one starting to come down. So right here is actually the fork of the duct. So we've followed it. If you refer back to this beautiful diagram on the board, you can follow it from the head of the pancreas into the bifurcation. This is the money shot for ruling out Bill-Dill. Whenever I have to rule out Bill-Dill, this is what I aim for. If I can use this and show them that the gallbladder was negative, no Bill-Dill through here, of course, imaging the liver showing no Bill-Dill, we're done, right? But if I miss this picture, I'm going to be hunting for a long time to try to prove that the whole entire duct is normal. We're going to get into following these ducts just a little bit, probably not today, but you also want to follow it through the pancreas, you know, to see if you see a pancreatic duct as part of the process when we find pathology. So, CBD, CHD, what's the name of the duct that comes off the gallbladder? Cystic duct. What's important about the cystic duct? If we see it, it's the division between CBD and CHD. Now,